Hello, I'm Fergus Scott. I'm one of the doctors at Sydney Ultrasound for Women. Hycosy, hysterocontrast salpingography. So what is a hycosy? Well, the hy, HY, stands for hystero, which refers to the uterus. Co, referring to contrast, which is the medium we use to pass through the fallopian tubes. And salpingography means the visualization of the fallopian tubes. Hycosy is the assessment of the uterine cavity, which is the same as what we do with a sonohystogram. However, we then proceed to assess the patency of the fallopian tubes. Uterine anomalies. They're more common than is usually recognized. It occurs, in fact, in around 1 in 200 people in the population. However, it's about 3% of those who are infertile and between about 5 and 10% of those with recurrent miscarriages. There are a number of different uterine anomalies, the most common being bicornuate. Next is the septate, didelphic, and arcuate. These are associated with spontaneous abortion, premature delivery, infertility, an abnormal fetal lie, cervical incompetence, and dysmenorrhea, which is painful periods, or endometriosis. Two-dimensional ultrasound can show images like this. We know there's something going on. We know there's two halves of a uterus, but we can't be sure what sort of anomaly. Three-dimensional ultrasound, on the other hand, gives us much better images. With a sonohystogram, we can identify the endometrium with much more clarity. We can determine adenomyosis, which is where some of the lining of the uterus extends into the muscle of the uterus, the myometrium. We can look at fibroids. We can see a uterus that may be what is called axial. Its direction is directly down the line of the site of an ultrasound probe, making visualization more difficult. However, with a sonohystogram, the clarity is much improved. Tamoxifen, which is a drug used by women who have had breast cancer. With a fibroid, we can look at its size and we can determine what proportion of it is within the uterine cavity. We can find polyps, we can assess uterine anomalies, and we can also look for uterine synecdoche. These are adhesions within the uterine cavity. So how good is a sonohystogram? The sensitivity is virtually as good as for a hysteroscopy, which is to look at the cavity of the uterus with fibre optics, which is done in an operating theatre. The correlation with transvaginal scanning is not quite as good, and that's because transvaginal scanning cannot find as many anomalies of the uterine cavity as can be done with sonohystograms. When we're assessing the uterine shape, the fluid we put into the uterine cavity will be shown on ultrasound as black, and the muscle of the uterus as this greyish tissue. So here we can see there is a septum. It comes to a V, and here we have an arcuate uterus, which is more of a U-shaped. Here we have an intrauterine adhesion between the anterior and posterior walls, and over here we have a didelphic uterus. So there are two separate halves of the uterus, one with some fluid within it, and this is one cervix. The other cervix here does not have the catheter in it, so we can only see one half at a time when doing a sonohystogram. Fibroids can affect the uterine cavity. They can indent it, which we can see on 3D scanning. We can see on 2D scanning that it's affecting the cavity, but with a sonohystogram we can see better just what the size of the cavity is and what proportion of the fibroid is within that uterine cavity. Polyps. These can be difficult to see on standard transvaginal scanning, and it can be difficult to distinguish between what is a polyp and what is secretory change. Finding of a feeding vessel using colour Doppler or power Doppler can be of assistance. With transvaginal scanning, a polyp can be difficult to see. Here fluid has been put into the uterine cavity, which is normal saline, and we can see the polyp quite clearly. Using colour Doppler, we can see a feeding vessel into that polyp. Some ultrasound machines have the ability to perform three-dimensional scans. A sweep here through the uterine cavity, showing the polyp, can then be performed. The computer side of the ultrasound machine can then reconstruct the image that we have, and an image which is much more recognizable both to the patient and the referring doctor is able to be achieved. Continuing on to a Hycosy. This is usually done in the first half of the menstrual cycle to avoid a pregnancy, and analgesia is frequently given. It's not normally a particularly painful procedure unless there is pressure needing to be built up within the uterine cavity, predominantly because of one of the tubes being blocked. This is a fallopian tube, and colour Doppler is showing the lever vest that moves through it. Here we can see fluid, the lever vest, passing through the fallopian tubes, or in a 3D reconstruction we can again see fluid passing through both uterine tubes. The advantages of a Hycosy include the fact that it's an outpatient procedure, so frequently it can be performed sooner. The contrast agent used is non-allergenic. It tends to be very well tolerated by the patients, and the results are immediate. The performance is comparable to a hysterosalpingogram or doing a laparoscopy and dye in an operating theatre. However, there's no radiation, there's no surgery needed, and it tends to be less expensive. Because the ovaries can be assessed on ultrasound at the same time, conditions such as polycystic ovaries can be diagnosed at this stage. Fluid passing through the tubes does flush it out, and there is the suggestion that this may increase the pregnancy rate. Disadvantages include the fact that the imaging sometimes is less than perfect. False results can occur due to the technique, and we do need to see spill of the lever vest out the end of the fallopian tube around the ovary and not just into the fallopian tube. Sometimes the end of the fallopian tube near the ovary can be difficult to see due to overlying bowel. And with any procedure putting fluid through the fallopian tube, even under an anaesthetic, tubal spasm can occur which will effectively block the tube. However, this is a partial blockage and not a lifelong blockage. The main complications with this procedure is that it can be uncomfortable, especially if the tube is blocked. It can cause the feeling of being quite faint. An infection can occur if this procedure is performed when the tube already has fluid within it, in other words a hydrosalpinx. However, the incidence of complications is very low. So in conclusion, Hycosy is a convenient and well-tolerated way to assess the uterine cavity and the fallopian tubes without the use of radiation. Uterine abnormalities can be difficult to assess without three-dimensional ultrasound or sonohysterography, which is part of a Hycosy. This is a very accurate procedure, and it's even possibly therapeutic. Thank you.